Over the past year, the city has developed a poverty measure that adopts the National Academy of Sciences recommendations and makes use of the Census Bureau's American Community Survey. Compared against the current measure, which only measures pre-tax cash income, the CEO poverty measure captures a fuller array of the resources available to low-income families. These include tax credits, nutritional assistance, and housing subsidies. That is essential for understanding poverty. Our measure also places those resources in the context of New York's high cost of living and the need to pay for child and health care. And that is essential to understanding the adequacy of our anti-poverty efforts. Under our new measure, the New York City poverty rate for 2006 is 23%. The corresponding rate for using the official methodology is 18.9%. That is an attention-getting difference, but it only becomes meaningful as we sift through the details to locate how and why the change in methodology affects specific groups. One of the most striking results from our work is that the poverty rate for elderly New Yorkers rises from 18.1% under the official measure to 32% under the CEO measure. The poverty rate for children, in contrast, hardly changes. It's 27.2% under the official measure and 26.6% under our alternative. Digging deeper, we find that the poverty rate for children living in single-parent families is considerably lower with our measure than under the official one, 41.6% compared to 44.4%. What these results are telling us is that even in the context of a more realistic poverty threshold, public programs, specifically the formerly uncounted tax credits, nutritional subsidies, and housing assistance, are lifting some children out of poverty in ways that could not be seen under a measure that did not count these resources. Our work also suggests that medical out-of-pocket spending is a considerable burden to low-income seniors. Findings like these will serve a variety of purposes. Most importantly, they will inform strategic planning by agencies across city government. We look forward to sharing the work we've done with other cities. However, it would be a mistake for the federal government to stand aside in the hope that local action can fill the need to change the nation's federal poverty measure.